Well, thank you very much, Simon, and can I acknowledge you and congratulate you on your election as President and more importantly, your role as event MC over the next 2 days of the conference. So congratulations to you. Can I also join and acknowledge your Secretary, Sarah Beeman, QNMU, and congratulate her and others who were elected during the recent round of elections. I counted, I think, 24 councillors, 4 branch executives, and of course the departure of Sally Ann Jones after 16 years. So to all of those who have been elected and to Sally Ann for her sterling service for this part of the union movement, I want to say congratulations to you. It's my pleasure to join with you all here today at your virtual annual conference and to say a few words about where the government is coming from and perhaps to explain a little bit about where we're at, because I remain very much committed to working in partnership with the QNMU and its members to deliver easier access to healthcare services for Queenslanders no matter where they are across the state. And as a result of that commitment, I was also delighted and thrilled to be able to accept Sarah's invitation to address you at your conference here as an extension of that commitment. And I think it's very important that I do engage with you and make sure that you are aware of where the government's coming from and to do so in a respectful way. And contrary to what the media might have you believe, I have enjoyed an open and respectful relationship with the QNMU. In fact, Sarah and her team were amongst the first of the important stakeholders to visit me after the election of the Crisafulli LNP government in November, and we've had an ongoing and respectful relationship since then. And as you can see on your screens there today, hopefully you can see that I am sporting a touch of pink as a recognition of the great work that the QNMU and nurses and midwives do throughout the state. Now, I understand that there are 400 branch delegates who are joining us online from branches around Queensland, and that is a real testament to the engagement of the QNMU across this great state. Let me recount to you a story. I was in Mareeba earlier this year visiting the Mareeba Hospital. It's been my real steadfast desire to get around and visit as many of our health facilities, of the over 200 health facilities there are in Queensland, as possible. And while there, 2 of your delegates were walking the floors, and I walked away the proud possessor of some QNMU material, including 2 very handy pens which get used every day. But it's a testament to the reach and to the engagement of your branches and your branch delegates throughout the state. And again, we had a great conversation and discussed some local issues up at Mareeba. I also want to reflect on a couple of things that Sarah quickly mentioned in her presentation, and that is working together for positive outcomes. And I want to reiterate our government's commitment to working together for positive outcomes for Queenslanders. Now, I know that we're in EB negotiations, and I'll touch on that shortly in a little while. But I think we do remain steadfast in our commitment, and I've picked this up in my discussions so far as well, to work together to deliver better health outcomes for Queenslanders. And I know that the government remains committed to proceeding down that path. There's no way that the government can do this alone. As Sarah pointed out, and we accept and have made this abundantly clear, there's no way that one government can do this just out of one William Street. We need to work across all sectors in the health portfolio area in order to be able to deliver those better health outcomes that Queenslanders expect and, importantly, deserve our public sector to be able to deliver. And that's our aim, to work together to deliver those better services. Now, having strong member input is important, especially at an event like this, and I understand the contributions of conference delegates over the next 2 days will shape the union's policies, actions and agenda for the year ahead. I understand you've got a motion there as well at number 1 on your list, and I understand entirely what that motion is about, and I would expect nothing less. I also want to take the opportunity to thank and acknowledge the staff who work in our public health sector, and particularly the nurses and midwives, and I want to acknowledge the people at the Royal Brisbane Women's Hospital. As some of you may be aware, I recently experienced the loss of a family member, in fact my dad, and I'm extremely grateful for the compassionate care we received and the immense warmth and reassurance that our family received from the staff at the Royal Brisbane and Women's Hospital. I call out Meg and Greg and Chris and Meg was wearing one of your pink shirts. And it didn't alter in any way, shape or form the care and compassion that was provided to me personally in the 8 hours that I was there in Resus Bay 2, or to our family. It was tremendous. And my heartfelt thanks to all who offer those services, not only to me, but to all Queenslanders in their time of need. Outside of my own personal experiences, when I travel the state, whether I'm in Cooktown or the Gold Coast, I regularly hear about the tremendous work and the positive impact that your colleagues, your members have in relation to the support they provide for Queenslanders around the state. Nurses and midwives come to know their patients deeply, not just at a medical level, but also personally. You spend more time with our Queensland patients than almost anyone else, visiting their bedside, providing comfort, expertise, advocacy and support. And it's these moments of communication, care and connection that people remember long after they have left the hospital and their engagement ends. Now, I want to talk about workforce, and Sarah mentioned workforce and the workforce plan. We're currently reviewing the workforce plan and looking at ways that we can improve both workforce retention and attraction. With our population predicted to grow by 8% between 2025 and 2032, this is an essential piece of work. Recently, at the Australian College of Midwives State Conference in Townsville, I discussed how our population over the age of 65 is expected to increase by more than 300,000 people. And those estimates are one of the foremost reasons we are steadfast in our election commitment to grow the health workforce by more than 46,000 people by 2032. And that includes 18,700 additional nurses and midwives. We expect we'll need a staffing uplift of around 25% in rural and remote hospital and health services. We'll need 38% in our regional hospital and health services and 47% uplift in metro areas to meet our current and future demand. But I am pleased to say that we are making some great strides towards this target already. Between November 2024, when I came to office, and May this year, the Queensland Health and the ambulance service workforce has grown by around about 4.2% or 4,700 additional staff. And as Sarah mentioned, our recent budget also provides funding for an additional 4,500 extra staff over the next 12 months alone. Now, at the beginning of the year, I had the opportunity to visit and talk with many of the more than 1,800 new graduate nurses and over 180 new midwifery graduates commencing their time with Queensland Health. And what was really positive to see was that more than 60% of the recruits were joining Queensland Health in rural and remote communities. On top of that, 630 new nurses and more than 50 graduate midwives bolstered Metro North and Metro South, the state's two busiest hospital and health services. Now, with much of our state residing and requiring care outside of the southeast corner, it is imperative that we have a sustainable workforce to deliver that easier access to quality care we talk about. We need to do it no matter where Queenslanders live and no matter what their postcode. So we are conducting a thorough workforce gap analysis, and we will be consulting with health professionals, including the union, to shape our state system-wide health workforce plan and inform those strategies that we need to attract and retain staff. Now, of course, it would be remiss of me not to discuss workforce without talking about the enterprise bargaining negotiations currently underway. And again, I did have the opportunity to listen to both what Sarah had to say and to what Simon's comments were. I want to be clear, the government is very keen to get a resolution of the outstanding EB matters. And we remain committed to delivering a real pay rise to nurses and midwives and to make that happen as soon as possible. Now, we may not see eye to eye on every aspect of the negotiation, and I think that's probably to be expected. But I remain committed to working with the QNMU, and we remain unwavering in our commitment to deliver nation-leading pay and condition for nurses and midwives. And while I am prevented, as is Sarah, from discussing our ongoing conciliation, I can say that process is progressing well, and I'm confident that we will be able to reach an outcome that will be satisfactory. For anyone who has participated in this process, whether that's in the form of partaking in the negotiations, providing feedback to a QNMU representative. I can tell you, if you're one of the many people who've left messages for me on my Facebook page, I've read those as well. I genuinely value that engagement and that contribution. And I am very, very much supportive of the role that the QNMU plays in these negotiations. I've made it clear from the outset that we are dealing with your union representatives, the QNMU, and only the QNMU, in resolving these matters. There is more work to be done, but they are being entered into in a spirit of goodwill, certainly from the government side, and I believe from the union side, to reach a satisfactory resolution. But I understand your frustration. There is a frustration on our side as well as we work with the assistance of the Conciliation or the Queensland Industrial Relations Commission to reach a resolution of these matters. I would like to touch on the budget because that's an important part of what Queensland Health delivers and the government delivers. And our budget of $33.1 billion over the next 12 months is a 10.2% uplift over the last budget. And it delivers, we believe, several big wins for nurses and midwives. Now, I understand that the QNMU have been passionate advocates for improved paid parental leave entitlements. This budget includes $192 million for staff entitlements, including reproductive leave and employer super contributions on parental leave that had been previously committed to but had been left unfunded by the former Labor government. We are filling that hole. There's $48.7 million being allocated to deliver the safer midwife to patient ratios, I should say, which again had been legislated but had been left unfunded. We're listening to frontline workers and their calls for increased safety, so the budget also provides increased funding of almost $9 million to boost the security officer and ambassador workforce for HHSs, because staff deserve to feel and to be safe at work. And additionally, we've made the largest investment in health infrastructure in Queensland's history. That infrastructure will better support nurses, midwives and staff to do the incredible work that they do every day. This we believe will ensure you have access to suitable staff accommodation and fit for purpose and world-class health facilities with designs informed by your feedback. But funding alone for infrastructure won't deliver world-class healthcare. Whenever I visit one of our services, my priority is talking one-on-one with health professionals about what delivering world-class healthcare looks like for you and how we can better support you in delivering it. Queensland Health is invested in your career journey by making sure you have a diversity of opportunities to upskill and reach your full potential. We want everyone to work to the full scope of practice. Now, I'm hearing positive feedback from programs like the Strength with Immersion or SWIM model, which provides clinical immersion experiences for early to mid-career nurses looking to develop their skills in specialty areas. And I also believe nurses and midwives can be leaders at any stage of their career. Opportunities like the annual Leadership Development Days, run in partnership between Queensland Health and the Australian College of Nursing, are one of the many ways we're upskilling both current mentors and future leaders. Finally, I'd just like to touch on birthing services. Between July 2023 and July 2025, 8 rural facilities experienced regular periods of birthing bypass. Now, our government has committed to restoring birthing services to Billawheeler and Cooktown, which have both been on bypass since 2022. Early on in our term, we committed to and commenced an assessment of maternity workforce needs. And our assessment of maternity workforce gaps at rural services revealed alarming vacancy rates, and I'm sure you're aware of them, including an alarming vacancy rate for midwives of 11.5%. Now, it's paramount we properly address previous infrastructure and workforce gaps to enable midwives to quite literally deliver Queensland's future. We want to see midwives able to work to their full scope of practice to restore these services, which is why we're developing a clinical guideline for Level 2 birthing facilities and enhancing access to virtual midwifery support for our rural and remote midwives. And this is not without some degree of controversy. I'm pleased to advise that through our investments, we are seeing tangible progress. Upgrades to the Billawheeler Operating Theatre and Birthing Suite were completed at the end of June 2025, and Central Queensland HHS has successfully recruited permanent midwives to that facility. Similarly, midwives have been successfully recruited to Cooktown, and the $200 million Cooktown Hospital redevelopment project, which will include a new birthing suite and maternity ward, will start construction, we hope, in early 2026. Now, it goes without saying that there is more work to be done, and we remain focused on working collaboratively with you and the QNMU to put Queenslanders at the core of our action. Now, like any good conference, and I've got my own organisations coming up as well, I believe you've got motions to pass and debate and policy to consider. And I'll leave you to do that. But in the short time I want to say I've been in my role, I've already seen firsthand how our nurses and midwives stand by their patients in their most vulnerable moments as they navigate the complexities, and it is complex, of modern healthcare. The nurses and midwives offer care that often goes far beyond the bedside. The dedication that they provide, the expertise and the compassion are felt deeply, and you are a driving force within our healthcare system. So thank you. Thank you for the extraordinary difference you make each and every day to Queenslanders who present often in distress, often unsure, and often unaware of what the future holds for them. I hope you have a productive and enjoyable next 2 days of your conference, and I want to say thank you again for the opportunity and the privilege to address you here on the first day. Thanks again.
Thank you, Minister, for your time today. It is greatly appreciated. And certainly we eagerly await an EB12 deal that recruits, retains and respects Queensland health nurses and midwives. We do have a custom here when we have guest speakers to give them a gift of our appreciation. This is not a curly one. This is a CD of a song that the QNMU not only wrote but actually performed and pressed in 2002 at our last industrial action with the then government. The lyrics mean a lot to us, and I would like to, with respect, offer that to you for you to listen in the car.
Thank you.
And thank you very much for your time. It is greatly appreciated.
Thank you very much.
Cheers.
That's it.
Thank you.
Thanks, everyone.
Thank you very much.
Wish you a good day.
Thank you.